The Hope Building opened in 2020. The first floor is critical care, and it has 48 beds. The second floor is a 48-bed multi-specialty step-down unit, and the fourth floor is going to be 48 specialty bed, half neurology and half cardiac step-down patients.
The vision is that these patients can stay in the unit, and hopefully we could provide that particular care of acute services within the same building.
Our multi-specialty units are specialty units that have multiple disciplines working together. We do multidisciplinary rounds with the intensivists, with nurse practitioners, with pharmacy, with dietary, all the specialties that encompass in the patient's care. We have a great training program, and that's one of the reasons why I came to Baptist, was the training that I was getting as a new nurse or as a new nurse into a specialty.
When you come and train with us in the Hope Tower, you will have the capability to flow to all those units. I have multiple of my nurses floating to different specialties, including oncology, cardiac, neuro.
Having the feasibility to see both sides allows, again, those nurses to expand later on in their careers, where they're just not, I'm just a neuro nurse or I'm just a cardiac nurse. They've been able to see a little bit of both, and hopefully in the future also venture out into an ICU setting, given the fact that they're already high acuity nurses.
We have educators on every floor, and those educators will meet with the staff along with the leadership team and help grow the nurses.
One of the things that helps these nurses feel safe and comfortable is that the rooms are built in with EICU.
You have an emergency, you're not only going to have the EICU capability, but you also have that continuity of care where the same doctors and practitioners from the group will come and will follow up on the patient.
One of the things that we have that we emphasize a lot, not only on patient safety, but mainly also on our employees' safety, is the Skylift. It is a device that hangs from the ceiling. So think about your Hoyer lift or your tenor. It's a device that allows you to lift the patient off the bed, be able to turn them without having to bring in that bulky Hoyer lift or the tenor into the room. Our hospital beds are connected directly to the nurse's station, especially with the exit alarms. It'll alarm at the nurse's station and it'll alert the staff that this patient's trying to get out of bed as well.
My vision is to have those nurses act like critical care nurses, have that specialty, that high acuity, and love what they do every single day.
Most of our step-down nurses historically have progressed to being ICU nurses. Our goal is to be able to mold nurses that will be strong nurses in ICU one day. The benefit of working at Baptist Hospital and on this cardiac and neuro step-down unit is that you're going to see a lot of patients that you're not going to see in other facilities. The reason for that is because Baptist is a comprehensive stroke center, which means that we have the capability of doing neuro intervention.
We also have an amazing heart program here with open heart surgeons. We have high acuity technology, high acuity patients. We do a lot here at Baptist Hospital.
When we talk about the environment and the culture in the unit, is to be able to have a unit that enjoys coming to work. It's to have a unit, a leadership team, an educator that like to work together, that like to learn from each other, that are excited about the things that we do on the unit and being able to see those positive patient outcomes.
We have all the resources, all the equipment, and all the teamwork that you are going to need to be successful in your career.